Can scoliosis cause breathing problems and pain? Scoliosis is a spinal condition, but it affects more than just the spine. No two cases of scoliosis are the same, and the more severe the scoliosis is, the more noticeable its effects are going to be. Breathing problems aren't considered to be a common condition that is associated with scoliosis, but in severe cases, especially of thoracic scoliosis, it's potentially something that can develop. Now, when we look at a thoracic scoliosis, it's a scoliosis that develops in the middle of the back. And the thoracic spine is the only section that attaches directly to the rib cage. And in the rib cage is what protects important organs like the lungs. And if this scoliosis curvature has become big enough that it starts to affect the shape of the rib cage and the shape of the rib arching, this changes the amount of space three-dimensionally for the lungs to function in. And when you change the position of the rib cage means that now the lungs will have to alter its position, and this can cause some lung restriction and potentially difficult for patients to inhale deeply. This also may lead to some discomfort while breathing, especially along the spine or the ribs. Now, lung impairment isn't always easy to detect, and it can be very hard to notice for patients that may have some because many patients don't use their full lung capacity. So we consider this to be a functional impairment, meaning most patients that have it may not even know, because most patients from day to day won't be using their full capacity, so they don't have any malfunctions or any limitations put upon their life. The only way to know is to actually have a lung capacity test performed. And some patients may never experience any type of lung issues or restrictions, even though they have severe curvatures like 60, 70, 80 degrees. There is no number of or size of curvature that's going to say you're going to have a lung restriction or impairment as a result of the curvature. But we do know as curves get bigger, they're more likely to cause these types of problems, but it doesn't mean they will. In fact, we know scoliosis can cause your spine to have pain for many other reasons than just lung impairment. In fact, in most spinal conditions, we know that the area of the body that's located to the misalignment is the most likely area that you're going to have any type of discomfort. And we know scoliosis that affects the thoracic spine or the cervical spine can cause to have upper back pain or upper back discomfort. And we know scoliosis can affect all ages, but we know patients that move out of the adolescent stage and become skeletally mature are more likely to have discomfort and pain as a result of the scoliosis compressing over time. And this compression leads to uneven pressure to the nerves and tissues that happens in the adult form. And this can affect the nerves, which can lead to pain related to the scoliosis. This compression can be in the upper back, can be in the mid back. It can also be nerve pain. And we also know that as scoliosis becomes stiffer, it becomes harder to move. And the stiffer the scoliosis is also typically associated to also age and size. So as the person ages, their curves become stiffer. And we also know as the curve gets bigger, it becomes stiffer. So therefore, trying to breathe can create restriction in the flexibility of the curvature, which can lead to some pain or discomfort that's happening in those areas. We also know that as scoliosis gets bigger, it causes more imbalances to the body and muscles. And sometimes these types of imbalances can lead to pain and discomfort in the area in between the ribs or where the curvature is affected. Now, we know the muscles are affected by scoliosis, like I mentioned, but one thing that I want to talk about is something that's called your diaphragm. Your diaphragm is what's inside your body that helps your lungs expand and inhale and exhale. And we know that your spine goes right through your diaphragm. And we know scoliosis is a condition that not only bends, but it also turns and twists. And the diaphragm is attaching to the spine. So when it rotates, it's causing a torsion or twisting within the diaphragm itself. And therefore, the scoliosis causes a muscular imbalances to all the muscles that you can kind of imagine in your chest and back, but it also causes an imbalance to your diaphragm. So therefore, sometimes this diaphragmatic imbalance can lead to some type of restriction or the inability to fully inhale or exhale. And this can lead to some other issues like muscles working harder to counteract this problem, and therefore it can become sore or it can become overstretched. So this type of imbalance can not only be things that we associate with like back muscles or chest muscles, but it can also be internal, which can be something that's going to be very difficult to manage or treat. So therefore, a lot of scoliosis-specific treatments practice breathing exercises to help encourage diaphragmatic use of the body. Now, we also know that scoliosis pain is typically associated with curve size. So as curves get bigger in the adult form, the more likely they are to experience pain. The same thing is true about lung restriction, that as the curves get bigger, they're more likely to get lung restrictions or malfunctions. So therefore, the way you try to improve somebody's pain that has severe scoliosis is you reduce the size of the curve to make their pain better, because you make the curve straighter and we decompress the nerve tissues in their bodies function better. Well, also what's said to be true about the scoliosis restrictions functionally. If they're having a functional lung issue, the best way to try to deal with it is to try to make the curve smaller, because the smaller you make the curve, the less impact the structure of the spine is having upon the body. So the best way to treat any type of scoliosis symptoms is to make the curve straighter and make the curve better. Now, no two curves are the same, or no two scoliosis cases are the same, but we know scoliosis can be treated, and we definitely know it can be treated with early detection and intervention. There's much fewer limits that can be achieved, but even curves that have progressed to severe or more severe levels potentially could be treated in a successful manner to make the curve small enough to reduce the effects that it's having upon the body. We know scoliosis isn't curable in any approach. Scoliosis surgery doesn't cure scoliosis, because the majority of cases we don't know what's causing it. So therefore, all treatments are about managing and reducing the size of curvature and keeping the body as functional as possible. Proactive conservative treatment approaches really customize the plan to impact the condition or the scoliosis on every level. We're looking at non-surgical approaches that typically combine chiropractic care, physical therapy, scoliosis-specific exercises, corrective bracing, and rehabilitation. And what we're trying to do is reduce the curve a significant amount to have a positive impact on any effects the scoliosis can have. And the best way to do this is to really reduce it before it becomes severe, before it becomes more significant. But if it already has, the best way to treat the effects that it's having is to make the curve smaller. Now, we know effects of breathing, or negative effects of breathing associated with scoliosis, or pain during breathing as a result of scoliosis, isn't considered to be a common effect with scoliosis, but it can happen. And it's more closely associated with more severe cases of the thoracic spine. But the best way to find out if you're having that is to have your lung capacity actually evaluated. But the best way to minimize the effects of any type of scoliosis could have on your breathing is to treat it proactively and to make the curve as small as possible to negate the possibility of those effects happening. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.